Try it again.
Ready? Am I in the middle?
Yeah.
Regarding sunlight and vitamin D. In the summertime, we have some folks that spend the majority of their hours out in the sun. Outdoor construction workers, lifeguards, runners, for example, will have a good exposure, and they usually will meet the suggestion of having between 30 and 100 on the units for blood testing. I actually follow 50 to 70 as a target goal, but the problem is that I think people get into a false sense of security when they get exposed to the sun, when they spend time in the sun and they become tan. The assumption is that they probably are getting good levels, and that's not always true. So whether you're in an equatorial country or state, or up in the north in Chicago, if blood tests show that there's a lack of vitamin D, in other words, anything less than 50, the suggestion is we increase for about 3 months and then recheck again. And that goes also with people who spend time in the sun. I've had a lot of folks who play in the sun, who do a lot of outdoor activities, and I check them and still have sub-therapeutic numbers. And vitamin D is very important to have as a building block for hormones and other actions that take place every single minute, every single hour in the body's cells. So the other thing with sunshine and vitamin D is that if you do take vitamin D, it has to be taken with food or fat. Vitamin D is fat soluble. That means when you take it on an empty stomach, it probably won't get absorbed. Vitamin D, in my patients, I usually say to make it easy, just combine vitamin D and omega-3 fish all together. If there's an issue with not tolerating fish, then we can switch off to krill. If there's an issue with not liking the taste of the fish, sometimes burping is an issue, or passing gas would be an issue. And there's a nice trick where you freeze the capsule and it prevents the burping effect. Just still have to watch out for loose bowel or diarrhea. So altogether, the majority of the studies show positive effects when you supplement vitamin D, and very minimal studies showing any detrimental or bad effects when you keep on with high dose. Sustainability is always important, so if you have a therapeutic response, then we cut back and see what you can do to maintain. You take as little of the medicine as possible, which is vitamin D3. D2 in 1/3 of the population does not get absorbed, so I try to suggest always D3. Pharmacies, when you go to the pharmacy around, at least in the Chicagoland area, about a year to 2 years ago when I was prescribing 50,000 international units once a week for 3 months, which is a protocol, well established. My patients weren't getting anywhere, and it turns out they were being given vitamin D2, which is plant-based D. D3 is animal-based, and the majority of folks do better with D3. So if you're not getting a response with your supplement, make sure it's D3. If you still have if you are on D3 and you're not getting it in, or therapeutic numbers aren't getting to where they're supposed to be getting, make sure you take it with fat. And if that's still an issue after that, you might want to either reconsider the supplement or look into some absorption issues in the gut. And that's it.
Out.